If you're an intactivist, then you need to listen to what I have to say, because this information is very important. And the insane obsession over circumcision in America never ends. You might know that there are 18 states that currently don't pay for infant circumcision under state-run Medicaid programs. We're about to lose one of those states. North Carolina is proposing to update their regulatory policy to have their Medicaid program, after many years, once again pay hospitals and doctors for performing infant circumcision. This is an all-hands-on-deck emergency. North Carolina hospitals are in line to once again start profiting from cutting baby boys' genitals. The elimination of Medicaid reimbursement for routine infant circumcision is one of the largest driving factors that reduces circumcision rates. What we find is that in states that stop paying for Medicaid circumcision, they also have reduced circumcision rates for babies covered under private insurance. This has been proven in several studies. The more we take out the profit motive from circumcision, the more the rates go down. The Health Equality Campaign has been working to expand the number of states that won't fund Medicaid circumcisions. But now, unfortunately, in North Carolina, we're on the defense. I found out about this really at the last minute, as the official public comment period was ending in early October. The public notice didn't provide much information on the proposed changes, and there wasn't sufficient time to find out more before the deadline. It's officially called the Medicaid and Health Choice Medically Necessary Circumcision Clinical Coverage Policy 1A-22. Talk about misleading Orwellian language. Babies don't have a choice, and infant circumcision is not medically necessary. I'll attach the draft policy on our website, link provided in the description below, which will bring you to the North Carolina action page. The Health Equality Campaign contacted the Chief Medicaid Officer for North Carolina, Dr. Shannon Dowler. We arranged a Zoom meeting with Dr. Dowler and 8 other high-ranking Medicaid staffers in the state. This is why we have the Health Equality Campaign, or as I like to call it, Intact PAC. A political action committee can get the attention of state officials. What Dr. Dowler said is that it was true. North Carolina is moving forward to restart funding for infant circumcision. She couldn't tell me how or who started this ball rolling. Maybe it was her. She did say that the recent CDC guidelines helped them decide it met the definition of medical necessity. Medical necessity is a key qualifier when determining if a service should be covered. So Dowler threw out a litany of reasons why circumcision is now a medical necessity, from HIV prophylaxis to preventing HPV, penile cancer, UTIs, phimosis. Of course, I was able to take each one of these phony reasons apart, even citing AAP reports and other statistics. I felt maybe perhaps after I was done, they might have realized there's more to this they didn't consider. She also mentioned it was a health equity issue, and that babies covered under Medicaid should get the same services that private insurance offers, as if the parents of these babies experience FOMO, fear of missing out, over cutting baby dicks. Unfortunately, we know about the many documented instances where babies, especially under Medicaid, get their penises mangled by bad circumcisions, like when doctors use motion clamps. But hey, it was covered. That's the background on this problem. It's a serious problem, and it's something we don't want to give up ground on. We already lost Colorado, and we're poised now to lose North Carolina. You can see how the CDC and the AAP have targeted state Medicaid to get circumcision rates back up. So if you want to join the effort to stop Medicaid from paying hospitals to mutilate babies, here is what you need to do. First, sign our petition on the action page. We will present this to Governor Roy Cooper and the State General Assembly members. Secondly, I need you to send your comments to North Carolina Medicaid. Again, the North Carolina action page has all the information you need to do this. It's at intaction.org/North Carolina. We've provided the most important talking points to help intactivists quickly get their letters written and submitted. We need to show a lot of public opposition to this change. It's really helpful if you're a North Carolina resident or have a North Carolina mailing address. Perhaps you can get friends and family members from there to also write a letter. If you can send me a copy of your letter, it will help me get a count on how many are being sent. Thirdly, I need you to send some funds to the Health Equality Campaign so I can get the resources I need to fight this. Make a donation on the form, which is located on the action page, or the funds go to the PAC account. The more we get, the more we can do. Our lobbyists are already looking into this issue to see what they can do to influence the outcome. But to take it further, I'll need to pay them. I'll have more information coming in the future, and as soon as I get it, I will disseminate it to you and the Intactivist community so you can be involved to the fullest extent possible. I know some of you are saying to yourself, Anthony has this covered. I don't really need to do anything. Or we should do something different, this, that, or the other thing. So I'm not getting involved. The fact is, I don't have this covered. If I did, I wouldn't be asking you for help. And if you care about stopping circumcision, you need to do something, because North Carolina's circumcision rates are going to rise unless we can stop this together. I've done all the preliminary work, laid out all the information you need to take action. Right now, I just need you to sign an online petition, put your name on a letter and send it, and donate a few bucks. It's really simple. Let's keep North Carolina hospitals from profiting off baby boys' foreskin. Let's do it.